My grandmother had multiple medical illnesses. I mean, really, she had heart disease, she had bad circulation, she had a little bit of dementia, and really, unfortunately, the bad circulation was becoming such a problem that she developed a lot of leg pain, and she really had struggled with that. My grandfather was having a really hard time taking care of her in the house, and really just didn't know what to do. They didn't have access to palliative care for someone to look after her pain, and her physician, who's a lovely, lovely man, cared so much about my grandmother, didn't have the tools to be like, this is what we can do to treat your pain. This is how we can get care for the home. Because, you know, my grandparents were like, well, we don't want a stranger in our house. But they didn't really get that they needed the help, and they needed a team and extra support to sort of help coordinate all of that. And unfortunately, they didn't. And my grandmother and my grandfather suffered emotionally. My mother and I were on the phone almost once a week on sort of how to coordinate. And I felt like it only took a crisis mode. She had to be in the hospital, something bad had to happen to her for people to realize that she needed this. She needed all this care, and I think the last 2 years would have been so much calmer if there was that layer of support that palliative care could provide.